This is the black V. Patient don't like this. They told you that we have gaps between our teeth, and there is a contact. So we remove, we do IPR, so we bring teeth together, so we reduce this black V. Stripping between to make space, and then we put power chain to make them, we close the space. So the black V become smaller. So the papilla will come and fill the gap. We don't do it, or we do it very slightly. It means that we can measure how much IPR we can do. We can do up to 0.5 millimeters. So in some cases, when we have a very mild decrowding for a young patient, we do it slightly. For example, we do 0.1 millimeter. Especially the doctors who do Invisalign. You see in the Invisalign, the clean check, they tell you that you need here 0.1 millimeters, 0.2 millimeters. So you can do light IPR. When there's small teeth, also it's not allowed to do 0.5 millimeters, it's too much. And where there is a root proximity, it's not also allowed to bring too much tooth together, because roots will be too closer. Any perio problem between, you will have a very big bone resorption in this area. So it's bad. Do it very mild IPR in this area. Be careful when you do IPR not to exceed 0.5 millimeter, not to change the shape of the tooth, not to do more than needed, not to do steps. I will show you now what I mean by steps, and always to polish when we finish the IPR. I will tell you also how. We talked yesterday about Chris. We'll see now the evolution of his case. When we do IPR, we do always IPR when it's aligned. It's not allowed to do IPR in this area, okay? Because we will damage the shape of the teeth here. We start the IPR here and here, okay? Later on, when we correct this, we can do in this area, okay? For Carmen, also, no need, just wait. When we do IPR in that
last case, you didn't put any coil in anteriorly?
No, because the coil will procline.
So the teeth naturally will fall back?
Yes, I use 0.12 niti or 0.16 copper niti, so the very light force. So we have to wait. And when we see the patient every month, we see that in this area it was crowded. We cannot do IPR at that moment. Now we can do, maybe we cannot do 0.5 millimeter. We cannot put the burr, but we cannot put we can put the strips, the metal strip.
Another question. If you use an arch stop to keep the anchorage from the teeth, you tend to want to drift forward.
No.
You don't have to.
No, don't have to, because this will not. There is pressure from the crowded teeth backward. Yeah.
And the lip muscle too.
Also, something I do, I always remove the wisdom teeth before I start IPR, because I don't want any force from the back that will close the space I made. This space is reserved for the crowded teeth. For Carmen, I want to show you when we do IPR, we preserve the shape of of the teeth, okay? And we create the space needed. If you put more, it's bad in Invisalign because it's programmed in advance. You can put power chain to close spaces. This is her after 1 month. Okay, let's try. Let's see what we don't have to do. Okay, something. Don't do it like this. Okay, be careful to do it. The bad thing that when we do IPR, just put a light pressure with your hands on the high speed. Don't push with your high speed, because let the burr guide you, because this is a weak area. This is a not hard tissue. Okay? Let the burr guide you. If you put pressure, sure you will make more, you will remove from a surface more than another surface. So let the burr guide you, and just one way. This is the shape. And this is a better view. This is okay, but here there is something we can, if we did this, we can remove it with a burr or with the metal strip. Because we have like, we forgot to remove this, okay? I said before that, look, the shape of the tooth here, the same, we preserve it, but here it's not.
This is usually about some patients have sensitivity for
When we remove 0.5 millimeter, it's safe. It means 0.25. When we say 0.5 from here, it means 0.25 from this tooth and 0.25 from this. It's too little to make the teeth sensitive. Let's do another. There's a thin burr. You have to find it. When you find it, buy too much because it's not frequent to. Here we're making mistakes. We're doing too much movement with the burr to do IPR. The thickness of the burr is 0.4 millimeter. So the maximum allowed is 0.5. So make sure not to do too much movement when we are removing, because you will be doing more than 0.5 millimeter. It's very bad, this. You can use, but the problem, we're discussing this issue with Dr. Paul, the problem of the disc, it will hurt the lip or the tongue. So be careful when you use it. Also, just one way. Don't do too much movement with the same place, because you will end with this. There is too much up and down. It's very bad, because you will exceed 0.5 millimeters. And make sure when you finish, don't make edges just to make everything round as it was before. Be careful, very lightly you hold the high speed. Okay, don't push. And if you are not sure that this is possible for you, just use a metal strip to make everything round. This is final. Now we'll see the strip. The metal strip, you can have it in one side or both sides. Try to buy the cheapest one. I will tell you why. You start polishing, and when you polish, don't try to use all the metal strip because you are using too much. Just use a small part of it because this part will remove. We say thank you and goodbye to Dr. Paul. See you next meeting, doctor.
Yeah, next week.
Next week. Okay. When you use the small part of the metal strip, and it's a cheap one, so the rough surface will become smoother, and this smooth surface will help also to finish the polishing. But if you use all the strip, the all surface will come to the tooth and you finish by also a rough surface. So just use a small part of it and use it till the end, till you see that the rough surface of the strip becomes smooth. This is the way, instead of changing the strips to from hard to medium to light, you can use this, the same one to finish the procedure. This is the final case. The bed here, we have removed more from this one to this one because we made too much up and down movement. Okay? So don't make it. Another thing not to do. This can be a nightmare, okay? We are removing, but we are removing only from the incisal area, okay? We are afraid to touch the gum here. So we're removing only from the incisal area, so we're sure that there is no bleeding. And too much up and down movement. We are moving the burr in different position, which is bad. Stay always horizontal. Look at the nightmare. Here, there's, if you want to put power chain to close the space here, it will never close because here there is a contact. Okay? This is a real case. We start from the papilla to the incisal area, labial and lingual. If your burr is tired, throw it, okay? Because it will not remove, so you have to push, and when you push, you will make mistakes. Just one way. If we have a thick tooth, we need to make round the edges. But if the tooth is thin, you start directly with the strip. No need to correct the edges with the burr. It's okay if you see blood, okay? It's normal. And don't give the patient a mirror to see what you're doing, okay? He will be afraid. Okay, this is 0.5 millimeter. Do it. Don't be afraid. Okay? Maybe the first time it will be hard. Maybe you will make mistakes. But it's a procedure. You have to do it if you are doing orthodontics. Yes, please.
How can we correct like something mishap like this happens? How can we correct it? Like if we remove excess or something like that?
I made this mistake before. I put composite. We have to make mistakes to learn. So try it. Don't be afraid, yes.
Do you have a control the code sensibility? If yes, what do you do?
Usually I never had sensitivity, never, because as I told before, 0.5 millimeter from the middle of the two teeth, it means 0.25 and 0.25. So 0.25 millimeter, if we measure the thickness of the animal in this area, it's like 2.5 millimeter or 2 millimeters. If you remove 0.25 from 2 millimeters, it's nothing. And you are not, you're removing from the contact, you are not removing from the gingival area where it's very thin. So I never had sensitivity. I advise you to use fluoride after this procedure, just to be sure that you're safe, you're not causing cavities in this area. And polish, please polish. Take your time and polish. Okay.
Usually after sliding, I use wood, the composite wood. It will prevent sensitivity directly for the
In case you have sensitivity, you use always.
I put it always to prevent sensitivity.
Bonding and light.
Bonding with light.
No, fluoride.
2 times, 2, 3 times.
Fluoride, no.
I don't use fluoride. And if the patient is much sensitive, I like him sensitive to paste and sensitive oral gel.
The IPR procedure, there is, as we said, there is two parts, the burr or the disc and the strips. What bothers the patient the most is the strips, the polishing, not the burr. So don't skip this procedure, even if the patient is feeling uncomfortable. Do it and make sure that when you see the strip, it's very smooth, the area that you have used, okay? So you are sure that you have well polished, yes.
Like a saw,
Sword. It cut. When I have from Invisalign, we can buy metal strip, expensive. You can use it different times. I use it if there is, for example, it's I need like 0.2 millimeters. For 0.2 millimeters, you cannot use burr. Even for 0.3 millimeters, you cannot use burr. So you have to use the disc or those strips because you're removing just a little bit. In Invisalign, they tell you how much you have to remove. In labial braces, normal braces, you decide how much. So if you do 0.4 or 0.5, you're safe because you will put power chain and you will close the space. But with Invisalign, if they said that here you have to remove 0.1 millimeter, make sure it's 0.1 millimeter. So use the tools that will remove only 0.1 millimeter. Otherwise, you will have spaces between teeth. Any question? Okay, the next speaker will be. Thank you.